Doctor, the other controversy, of course, Professor Steve Hanke, he's a professor of economics at the University of Johns Hopkins. They listed India as a bad apple. That's a quote for alleged underreporting of coronavirus cases. The same Professor Hanke in March had predicted that the coronavirus situation in India was spiraling into chaos. And of course, Johns Hopkins has been leading from the front with a global tracker for coronavirus that's used by media organizations the world over, so it's extremely credible. So what would your response be to this?
So I think there are 2 or 3 things that we need to keep in mind. One is the population density that we have, the number of population that India has is you could have a large number of countries in Europe you could combine, and that would form the population of India. I mean, some states have more population than some countries in Europe. And our challenges are different. We have constraint as far as the health infrastructure is concerned, and therefore we have to find our own solutions. In terms of testing, our testing has been ramped up from when we started about 10 to 20,000 tests a day to now almost 1.5 lakh tests a day. There's still a lot to do, I do agree, because considering the size of our population, we need to continue to ramp up our testing. But I also agree that we need to develop strategies when we say that we are testing to answer specific issues. Just random testing in our entire population is not going to be useful. If we were to say at one point in time we test 5% of our population, that turns out to be something like 7 crores. And this is an evolving disease. Testing today doesn't mean that you can't get the infection tomorrow. So we have to have a concrete strategy. But I also think that besides testing, individual responsibility, the social responsibility becomes huge in terms of being able to take measures to prevent the spread of infection. Somehow we haven't been able to get that message across, and people don't seem to understand their responsibility in fighting this pandemic. This pandemic is going to be fought by people in the households, in the streets and at home rather than in hospitals.
What should we, the viewers, all of us, be looking forward to? How long will this be expected to continue? Because today the news, of course, the big international headline has been that parts of Beijing were put under lockdown again due to fresh coronavirus cases. A new cluster, Beijing's first case in 2 months after somebody visited a meat market. They had no international travel outside. So it's a dismal note to end on. But does this mean that this could reoccur?
So it does mean it could reoccur. That's why a lot of people talk of what we call the second wave or subsequent waves, because if we are able to contain the virus and prevent its spread, and that will happen over a period of time, both in terms of the fact that a large number will get infected and there will be some herd immunity, and if you have some immunity, you then are not able to spread the infection to others, and therefore that chain gets broken. But at the same time, there is always a chance that the virus may remain in some individuals. And if we don't follow our precautions that we have been saying for the last few minutes, it will again lead to a cluster development. And this has been shown even in history. If you go back to even the 1918 pandemic, it came in multiple waves. And actually, the reason for these waves were because people let their guard down. Once they felt that the peak was over, it was coming down, they felt now everything is okay. They started having parties, going along, meeting everyone without the restriction, and this led to a resurgence of cases. So I think we need to be careful even when we are across the peak, because you never know when another cluster may develop.